All right, well, welcome everybody to the VCU pain class. So this class is actually done in part actually up in Richmond with MCV. They actually do this at a lot of their outpatient rehab clinics up there. But because of seeing how they did it, I kind of wanted to go up and observe and see what could we do to kind of give something down here to the CMH region, because there's been nothing that's been really done that covers pain to this level before. So I'm glad that this was able to happen. Now, yes, some of the stuff in here I have taken from a few very internationally known pain researchers, because some of their pictures and analogies are just so good. So yes, we did use some of that, but we have permission for that. So rest assured, we won't run into that. Oh, maybe once the thing works. Okay. So when we're talking about pain, we have to really start at the beginning here. So I know a lot of people, and there's going to be a desire, and I understand this completely because I'm a human being as well, is we all want direct, specific answers for me based on myself. And I understand that completely. However, just because today how we're going to be talking about this is we're going to be talking about pain in a very general sense, in broad general terms. For specific stuff that's revolving kind of your specific issue, that would require an evaluation just from how many, whichever providers that you need, depending on your issue, to give you the best specific answer, depending on what's going on. So remember, this is all in broad general sense. Of course, if you know, and of course, follow up with your healthcare providers as you need. Because we are recording this, I'd ask, please. I mean, we'll definitely have some question time at the end. Just I would ask that you please hold that until the very end. Um, I know people are going to see later. They're going to see, oh, we're going to talk about exercise, and everyone's going to want to jump right in. Make sure you've talked with your doctor and your appropriate provider before consulting or starting anything first. This is just information about it. So I just want to make sure we're clear on that. Now, I'm curious, why are you guys all here? Like, what's the reason what do you guys hope to get out of this? I'm always curious. Okay, good. Pain. Any others? Love it. Love it. Anyone else? Good goal. I hear that one quite a lot working with clients. That's very fair. So, and I think those are all really, really good, because the purpose of this is, again, because pain can be so multifactorial and pain's really complex. There's a lot of things that can cause pain, and I think we have to be really specific and know exactly what we're dealing with to give the best individual answer on that. However, the kind of the thought process I had for this is that the more that you guys know overall about how pain is, how it works, all the things that can contribute to your pain, and I'm going to go through a lot of things today that's going to talk about things you can do. And my hope is that you all think about your situation, think about your experience or whatever, or whether it be for you or for someone else, and reflect on that and take from what you've learned, like, you know what, I didn't think about sleep. I didn't think about some of these other avenues to improve lifestyle to see if they could help my pain. And really think about that and see how can you do that and start in the best way that you can given your circumstances. That's really kind of my goal for this, because I know I can't be super specific to everyone, but I want you to know a bit more about pain because it is important. So a little bit about me. I don't know how much you guys can see the map here, but of course, my name is Brandon Poen. I am one of the physical therapists at the Outpatient Rehab Center here at the Hendricks Center. Been here for a little bit over a year. As you all probably are more than can clearly tell, I am not from around here because of my accent. I am actually from Illinois. That's where I went. That's where I grew up. That's where I went to PT school. Then after that, I went to Michigan and Detroit for a couple of years because my wife, who was my girlfriend at the time, was finishing up medical school. She actually got matched for her general surgery residency up at MCV. So that's kind of how we ended up coming to Richmond all together. So yeah, we got married last May and it's been going good. And then that's us barely standing after doing the half marathon. So yeah, just a little bit more about me. I like dealing with and treating mostly people that have musculoskeletal type pain, orthopedic stuff, sports injury, some neurologic stuff. That's kind of what I love to treat and specialize in more so. Now, beforehand, I kind of talked about like, why are we talking about pain? Well, there's a couple other reasons why we want to have a good understanding about it. Number one, research has shown that people that are in persistent pain, that the more they know about pain and the more they have a better understanding based on what the science says about pain, the better on average they do on the long term. Does that mean it's fantastic? No. But does it mean that they do better than those who don't? Absolutely. 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 Also, what we know about pain has changed immensely. in the past 20 to 30 years. We used to think it was such a simple thing as one pathway and there's one part of the brain, and we have been proven very wrong that that is not the case, and pain is much more complex, and our understanding of it is still changing. So the more we know about that, the better we as consumers can be better informed to make decisions. It also kind of gives about, it also lets people do some of the things they like to do. I will admit, when I am working with a client in therapy and we're going through some pain education for some people, my goal is not to turn them or you guys into pain encyclopedia people that recite that stuff. That is not the goal of that at all. My goal is that people know enough to know, okay, I know enough that gives me permission to do some of the things I've been either fearful of or avoiding because I'm afraid I'm going to be hurting myself. And one of the key things we'll get in here is hurt doesn't always equal harm. Sometimes it can, but it doesn't always. So that's one key thing. So it kind of helps give people permission to move and take more of an active role, because at the end of the day, we also know people who take an active role and are taking active steps in their recovery and whatever they're doing tend to do a way lot better than those that are just looking for passive care and not really taking steps to move forward. So pretty much this is kind of the overview of what we're going to talk about. We're going to go into specifically what really is pain, how common is it, what happens to the brain and the body when we've been in pain for long periods of time, and kind of how that can explain why someone might have a certain experience, or they might explain some of the symptoms that they're having. We're going to go through some key pain points, especially going through what can contribute, but also discuss a little bit about imaging, because that's something we hear very consistently about imaging findings that they found on my X-ray or MRI. So we're going to go through what the science is saying about that overall. And then last but not least, the thing that most people are probably wanting to know more about, or what are some strategies or things I can consider to do in my lifestyle to help making my pain experience better. So what is pain? Exactly, right? We got to be a little bit more specific about this. So from what we know from the best pain organization in the world, which is the International Association for the Study of Pain, they define it as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. We can have pain and have tissue damage. We can have a lot of tissue damage and not have any pain. Have you guys ever walked around and you've kind of noticed you had some bruises in your arm, but you have no idea how they got there? Yeah, it's the same thing. Tissue damage happened. That bruise damage happened there, but you didn't feel pain because the brain didn't think that that was important enough to give a pain signal out to make you aware of it. We can also have the opposite. We can have not really much tissue damage and we can have a lot of pain. So it's a spectrum. It's not one or the other. They all can exist. Now, yes, it is true. Pain is produced 100% of the time by the brain. That does not mean it's all in your head. That does not mean it's not real. All pain is very real. It's just that the structure that determines whether something's painful or not is the brain. So you see at the bottom, I don't know if you guys can see on the bottom left, you see how that guy's about to step on a nail? So that's pretty much what the picture is. There's a guy and there's a foot and it looks like he's about to step on that nail. That's going to hurt, right? That's going to hurt like heck. What happens and how pain works is that he's going to step on something that's going to activate some receptors in his skin. That's going to send a signal up to his spinal cord. That's going to send a signal up to his brain. And his brain's going to make a determination, should I make that hurt or should I not? The brain's going to realize, yeah, that's a dangerous situation. That could really hurt and cause an infection or something like that. So it'll send a response saying, yeah, make that painful. So once we know it's painful, we come right off it. Same thing with the hot stove. Touch the hot stove. Ow, that's hot. Brain's like, that's going to burn you. Get off it. It's the same thing. Now, when we're talking about this too, sometimes it's supposed to do this. Pain is meant to be protectionary. It's meant to be that way. We need to, if we don't feel pain, we can be in really bad trouble. If we, like, especially for certain medical conditions or certain presentations, we need to have pain in order to figure out what's safe and what's not. However, sometimes we also have to realize though that all the time, the pain is always produced by the brain. There was an interesting thing where they looked at soldiers. I don't know if you guys ever heard about this in like the Civil War and World War I, where they looked at soldiers' pain levels like on the battlefield, and then they looked at their pain levels when they were back in the hospital. Guess which one had way more pain? Which group? Yeah, in the hospital. Because when they were out in the field, they did not care. Do you think the brain cares about pain so much then on the battlefield? No, your body's like, I am going to do whatever I can do to survive. I will push through it. I will do whatever we need to do because we need to survive. Now, afterwards, does it hurt? Oh, yeah, it's the same thing. And it's the same thing like if you rolled your ankle hurts. But if you're in the middle of the road walking across the street and a bus is coming at you, your ankle probably doesn't hurt so much, right? Right, because your brain's going to realize ankle hurting, survival. Which one wins? Survival's going to win. Now, afterwards, is your ankle going to hurt and maybe swell? Yeah, but your brain makes that call in the interim to kind of make that decision for us. And sometimes it can be really good at it, and sometimes it can do its job too well, which is what we're going to get into. Hurt does not always equal harm. That's a tough one that took me a while to wrap my head around when I was first learning this, because how we were thought about pain was it was to actual, pain was always meant to protect us from all kinds of damage. It's not always the case. There's a really good video of one of the internationally known pain researchers. His name's Lorimer Moseley. And he had this story where he was basically walking in the forest and he felt something touch the outside of his leg, didn't think much of it. He ended up passing out 15 minutes later, being bitten by a venomous snake. So he survived. He survived and he was okay. He comes back, I forgot how long ago, but a certain amount of time later, he's in the same location. He feels something touch the same thing on his leg. And guess what happens? This man is in agony on the floor. But what touched him? A twig. There was no snake bite, no nothing. But because his body remembered, hey, last time you had that same thing, same situation, same sensation, you almost died. I am going to make this hurt so bad because I didn't pick it up the first time so that you pay darn attention to it. So he had a lot of pain, but he didn't have any tissue damage. So I just think that we need to be aware that that can certainly happen. And pain's also a little bit more complex too. I know we got some structures here. Up here we have a few images of the brain, and down here we have scans, which I'm not sure how well you'll be able to see these. But when we think about pain and stuff is not always associated in one area of the brain. So if we think about, if you close your eyes, if everyone closes your eyes, and you think about your grandma, what are the things that come to your mind? Could be food she made, could be how she made you feel, it could be experiences that you had with trips and family, and the list can go on and on. You can open your eyes. But the point I'm making is that all those different things that you can associate with that are in different spots of the brain. So when we're looking at the picture, when we think about grandma, we're not just thinking about an isolated thing. We're talking about our memories of what she looks like. We're talking about some of the smells from cooking. Like we think about different things when we're thinking of something like that. So that's why when we think about one thing, a lot of areas of the brain get engaged. And unfortunately, this also happens when we're in pain too. Pain kind of works the same way. I don't know how well you can see this at the bottom, but down here they actually have a few scans of people's brains. On the top row, it looks perfectly normal. All white and everything, clear. The bottom is when someone is in pain. And I don't know if any of you can see this, but if you look carefully enough, you'll see a lot of red splotches throughout that spot. Much more hyperactivity in the brain associated with that. So the point of that is basically saying that within the brain, there's a lot of things that can go on, and there's a lot of things that can happen when it comes to pain, and it's not always so simple. Now, how common is chronic pain? So first, how do we define what's chronic? Like, what does that actually mean? So how they've defined it as pain lasting for 3 to 6 months or longer than they would have normally expected that tissue to have healed on its own when it's lasting for beyond that time. Now, how common is it? 1 in every 5 US adults has chronic pain as it currently stands now in this country. And truthfully, it is probably a huge reason that our healthcare costs in general are out of control. Yes, there's other things like diabetes, heart disease, and cancer, and I'm not denying that for 1 second. They all contribute big to our healthcare costs as well. But if we look at overall a big piece of it that we're not doing a bang up job with, it's pain. Pain's costing a lot, and we're not doing very well with it, to be honest with you, in the whole grand scheme of things. When it comes to even as well, there's a lot of little stats in here, which I'm not going to read through all of them because I don't think you necessarily need to go through all of them. But I thought they were really interesting. And some other interesting facts that I want to talk to you, especially regarding low back pain. Because when it comes to musculoskeletal pain across the country, the low back is probably the one that everyone talks about the most and is the one that is most commonly referenced or has the highest frequency. Did you guys know that about 80% of adults in this country will experience low back pain at least once in their lives? At least once. 80%. 80%. And actually, low back pain is the most common cause of job-related disability and leading contributor to missed work days. So it's a big reason why a lot of people aren't working or they're really limited in what they do. Now, I don't know if you guys can see this chart super, super well, but I always think this is really interesting. So one of the big things that I hear from folks all the time is there's always this understanding that arthritis is a big reason why I'm having pain, right? And that certainly can have some relevance. But you know, the funny thing though is that actually, as our risk of developing arthritis improves, that's kind of this green kind of dotted circular line here, actually the incidence of low back pain goes down. Low back pain as it stands now, the most majority of folks that are really suffering from that are within the 30 to 50 age range, middle age. Why that is, there's some debate about it. Some of it thinks because of the structure of the discs and the hydration levels, and as we lose that, that can maybe alleviate that to some degree. They're not entirely sure. But the long story short I'm making is that even though our chances of arthritis goes up as we age, our instance of having pain, especially that's reported low back pain, is not reported near as much. So arthritis doesn't always mean pain for that way. So I just wanted to clear, I think that was just a really interesting demographic when they showed that. Now, what probably a lot of you really do want to know is what happens to the brain and the body when we've been in pain for long periods. So remember, this is 3 to 6 months or beyond that, or beyond what we would have expected that tissue injury to have taken place at. What happens is when we have, so remember when we step on, that's the guy stepped on a nail. That nail was a big enough level to where his cells in his body reach a certain threshold. They send that signal up to the brain and say, hey, there's a problem. However, during our normal day, we have some wiggle room before our body will send up a signal that strong. What can happen though is when the body has been in pain for a long time and we start avoiding things and we start having more fear and there's a lot of things that we don't do or do when we're in pain, is that this room for activity before a painful stimulus is going to be applied gets less. So it takes much less to flare it. So people usually realize, like, you know what, I used to be able to walk 30 minutes before I had a problem. Now it's like 5 minutes. Before, I used to be able to take out the groceries, no problem. Now I have to go in 2 trips with a reduced load, you know, because I just can't do it. And that threshold that threshold to buy us time has really gone down. Because here's normally where we are, and here's much room and how much activity we can do before our body's going to say, hey, that's enough. But when we've been in pain for a long time, the brain and the nervous system gets a lot better at producing it, and it's going to facilitate that pathway more. So pretty much that means is our normal level is still the same, but what it takes to actually get our pain response goes down. And eventually that goes down and down and down to where people are living in pain constantly. Does this make sense? This is a really weird kind of avenue, and this took me some time to get around. Because how pain changes in that is kind of a big thing. And now there's a couple different ways we can go down it. You see there's 2 circles, there's 2 paths we can go on this. We have an injury or an episode or something happen, shall we say, and we have pain. Now we can go down one of 2 roads. We can either confidently address it and move into the things we know we need to and confront it and get better. Or we start avoiding things. We start worrying excessively when it's not the case. We become very fearful and limit what we do. Then we stop moving or using our muscles and doing a lot of the stuff we like to do. Then we get really depressed and we go down a very bad route. And then that just keeps feeding into the pain experience. The goal for this class also as well is that you know enough to either, if you're in here, start to get more over here. To start to figure out. Now, I'm not saying everyone's automatically going to be there because everyone's pain experience and why they're having it is different. And I'm not saying that's going to fit for everyone. I'm not here to say that because it depends on what's going on. Okay. Welcome, welcome. All right. So what does the research find that we know are some of the big contributors to pain? 1, lack of exercise. 2, what we eat. Believe it or not, having foods that are more inflammatory in nature, more processed and sugary, there does seem to be an association with that. Sleep. Poor sleep quality over a long duration has been actually in the research been found much more recently to have a very strong predictive ability for pain. And not even just that, they've actually even found that people that have had very poor sleep quality for many years do have increased chances of developing certain types of neurological conditions like Parkinson's disease, dementia, and such. That has been shown. Temperature. How many people, when they have pain or when it's cold out, have pain? A lot of people. A lot of people, when it's cold, they hate it. They hate it when they has that. And people are always wondering why that is. So some of that can be joint related. There's no question about that. But sometimes when we were talking about the nerve sensors before, is that some of them actually have a little bit more sensitivity to temperature compared to some other things. So I think that's always interesting. Movement and our basic mechanics can certainly have an influence on that. If we've got certain musculoskeletal mechanical issues going on, that can certainly be a contributor to pain as well. Our psychologic status, so what we think and what we believe, has a huge role in in people's pain experience. Someone who thinks that they have, okay, I have a little bit of a back pain, but it's not a big deal and it's gotten better and I can go through it, compared to someone who's extremely fearful and guarded and limiting and not doing anything, that person's clearly not going to do quite as well comparatively. So what we think and what we believe about what's going on can have a huge impact into how we actually move and how we actually recover. And a lot of times it's people that, when I see people are really having a very, very negative view and they are very trapped and they feel that there's nothing they can do. And sometimes, honestly, the biggest thing is just getting over the mindset hurdle. That's huge for a lot of people. Social support, of course, family, home, having a good support environment, that's obviously huge. Um, Past treatments, so what you've tried before in the past in terms of whether that be medical or pain related, hasn't helped. We do know that the more imaging someone has and the more treatments they go through on average that have over a long duration of time, the worse prognosis they generally do comparatively. We went through beliefs and mindsets. I also can't deny medications. Certain medications, depending on what's going on for us, can certainly change what's going on in our bodies. That can certainly change our pain levels, no question. Our health, obviously. So if we're not taking that great care of ourselves, or if we have a certain condition that's just naturally a bit more fatiguing and just normally takes out a bit more energy, that's definitely going to have an influence as well. Our age, our stress. I mean, stress is not something we can necessarily avoid as adults. I mean, we all have it. I mean, there's no way we can get around it. But what we find though is that how we respond and how we view our stress actually seems to have more of an impact. Does anyone here watch TED Talks or have heard of a TED Talk before? Yeah. There's a really good one that's done by a specialist who's just studied stress religiously, and she used to thought that just stress in general was bad. Like that's why people were having heart attacks and strokes and having their blood pressure through the roof, is because, we're just having a ton of stress. And it's actually not finding that it's so much the stress, it's how we view the stress. Because they found that people that view their stress positively and they find ways around it that they can do manageably don't have the negative physiologic reactions and near the risks of early mortality that those that view it badly. Because those that view it badly, honestly, on average, their physiologic reactions when they studied them were way worse, and they were much higher to have early mortality. So it's not always the stress, but it's how we view it. That can be a big thing. And if anyone wants that TED Talk, I'm happy to share it later because it's really, really fascinating. Oop. All right. Imaging for musculoskeletal pain. Now, this is not imaging for any other kind of pain, like when we're talking about the heart or any organ system. That this is not for that at all. This is just strictly looking at bone, muscle, tissue, and kind of mechanical movement-based stuff. Like they've scanned the low back, scanned the neck, scanned the shoulder. That's what this is referring to. So there's good things and bad things about imaging. Would you believe that a lot of people, especially a lot of you all right now, more than likely have abnormal imaging findings on your images if you were to be scanned right now? A lot of us will. They've scanned and they've done this through the low back, the neck, the shoulder, the knee, and they've scanned people that have no pain, no limitations, no nothing. And they look at the MRIs and they're seeing, what are they seeing? They're actually finding that a lot of them have really, really bad stuff still. Their MRIs and images are not super clean. They'll have disc bulges. They'll have they'll have a lot of weird stuff in there, but these people don't really have pain or are limited. Now, I'm not saying imaging is totally bad, because sometimes we do need it and sometimes it does show some stuff. So I'm not saying it's never relevant. I'm just saying imaging by itself is usually, from what they found in the research, has not been to be super strong. How many of you, if you've had therapy in the past, have been kind of upset because they didn't do an MRI immediately? Really? No one raised their hands. Usually that's at least half my people. They're like, I want to get an MRI immediately, right? Unless there's a really solid reason for that, if there has been a major trauma, if there has been some red flag signs, if there is some progressive neurologic stuff, like their sensations getting worse, their strength's getting worse, their reflexes are changing, and it's not responding within a time frame they have been, then yeah, an image is definitely warranted at that point. But for a lot of people, a lot of times you can modify symptoms very clearly with a lot of movement-based stuff. So they don't want to spend all that money pretty much to, because because I mean, what's that image going to tell us anyway? I mean, the image may not necessarily tell us a whole lot anyway. It's like, okay, you have a little bit of degeneration in this spot. That's They're finding that so commonly in a lot of people. So the image doesn't define you, because there's a lot that image doesn't tell me. That image doesn't tell me your pain that adequately often. It doesn't tell me your strength. It doesn't tell me your movement. It doesn't tell me your function. It doesn't tell me how you do your normal stuff. There's a lot it doesn't tell me. So I'm not saying it's not relevant for certain times, but we should not be using imaging by itself to just make the definitive diagnosis on what's going on. And that's a tough one, because a lot of people aren't always sure, are kind of shocked when they hear that, because our system right now is so very much over medicalized, and that's kind of what we're used to in this culture. We go into the doctor, we get an X-ray, we get an MRI. After so much time, it didn't work. I've got these pain meds for a while, didn't work. I'm okay. I'm going to go back. All right, let's go for the MRI. Okay, that means we're going to go through injections or surgery. But you know what? Let's try PT, or let's try some form of conservative care to see what we can do. And that's sadly kind of how most patients actually progress through the system. It is unfortunate, but that's unfortunately just kind of how it is at this time and such. So, bottom line, imaging is not the full story. Even if you're told that, hey, you've had a little degeneration here, who doesn't? Who doesn't? Most people do, okay? But the key thing is there's people that can have horrible looking MRIs do great. I've seen people with pristine MRIs still miserable in pain. So the spectrum exists. So don't let that imaging define you, because sometimes that's what a lot of people will think. Like, you know what, I was doing great until I had that X-ray, and they said I had this little spur right here, and ever since then I've been in miserable shape. And I'm like, that person did not need to know that. I tell patients, if they're going to get an image, here's my recommendation. I would tell the doctor this, you know what, scan it, call me if there's a big problem. If not, don't tell me. Don't tell me results, because people honestly will think that. They'll see the report and they'll think it in the back part of their mind. And then usually at some point later, then they'll start to develop something. So unless there's something major there, and usually the doctor will call you immediately if there's a big problem like that. They'll call that office. They'll call you back if it's a big deal. That's what I tell folks. Now, we know a lot about this, but okay, great. Now what do I do, right? What do I do about it, right? And that's the key thing. So one of the big things, we're going to talk about the big things that have been found across the board, all the factors that we've talked about that can help people make a big step forward. Like I said before in the beginning, for your individual thing, you need to talk with your provider and figure out what's exactly going on to get you on the right path exactly. But exercise, which I know I feel like people either love it or they hate it. Exercise by far has been shown, in terms of persistent pain, in terms of from the evidence and the research, has been one of the strongest interventions in helping people with persistent pain. Is it perfect? No. Is it great in terms of the evidence? It's not fantastic, but I'll be honest, it's probably among the best we currently have. And I will tell you right now, the patients that I do see, and this has been documented, the people that are more active and taking more of an active recovery and are being more healthy, their disability and their limitations by pain are way less than those that don't. Now, does that mean I am not advocating that you go out and join a gym immediately and you go load up heavy weights or you do something crazy? That is not what I'm saying. That is not what I'm saying at all. What I do think is important, depending on what's going on and if your doctor's approved or let you start to do some activity, is find out a way that you can do that you can still get a few times a week in that gets different things to get you moving forward. There's a lot of ways you can exercise, whether it be the pool, like we were talking about beforehand, whether you like Tai Chi, whether you like doing light weights, whether you like doing like stationary bike or walking, stay active. Keep active. I will admit I'm a bit of an exercise bias junkie myself. And what they have found is honestly that people that can combine, aerobic, so cardio, strength, flexibility, and balance, especially as they get older, tend to do the best than those that just stay in one type of training because they're working different things. They're working their heart, they're working their muscles, they're working their balance, and they're working their movement. Those folks tend to do better than those who just do aerobics. I can't tell you how many runners I see that just run and they don't strength train and they wonder why they have a problem. It's more common than we think. Now, what I have on here, and you're probably wondering, what does this chart even mean? I did want to share the World Health Organization's guidelines that they do recommend in terms of aerobic activity that they recommend that we all get. Now, what they do recommend is that we have a moderate intensity cardio for at least 30 minutes a day for 5 days a week. Now, what does that absolutely mean? Here's pretty much what they have encountered moderate level intensity to be. Now, let's be fair. This is meant for the more average person who's not limited and who's not really having a lot of significant health issues. Now, for you, someone might think, well, if we're talking moderate versus vigorous activity, for me, walking might be vigorous. And that's a fair, like that's certainly possible. So I think you have to know yourself, know your line, know your ability and what you can do and modify appropriately for that. So they do recommend that. And they do recommend if you're going to do vigorous level activity, about 20 minutes a day for about 3 days a week. Like I said, yeah, pick and modify your activity based on what you're able to do and be consistent with it and stick it out. You're not going to get immediate results if you do it for just 1 to 2 weeks. It's the body does not make that kind of long-term change in the tissue that quickly. It really doesn't. If we are going to see a quicker change in that, cardio is where we're going to probably see a bigger change more faster. To get stronger is going to take at least a couple months of consistent training at a right intensity to really get an appropriate change that tissue can able to adapt to. It does not come overnight. Like I said before, talk with your doctor to figure out is that the right thing and find out how you can modify. There's a lot of people that will put off certain activities or certain movements. I see it in the gym all the time when I work over there. I see a lot of people that are afraid to do certain little things. It's like there's such a simple way you can modify that based on what's going on for you that you can still use it. And maybe we just haven't found that modification yet. And let's talk it out. Ask someone. They can help you figure out a way you can do it that you can do for you. So don't just think I can't do that. Well, see if there's a modification. And if you can't do that variation because of that, okay, that's fair. Maybe that exercise is on hold. Maybe let's find a different way to address that area that you can do. Okay. Now, when we're talking about this, I know everyone is always wondering, well, gosh, what about if I'm having pain with a little bit of exercise, right? Comes up a lot. What they're finding in the research actually is that depending on the individual and across the boards, as long as you're nudging the pain and you're not overblowing it, you're going to be okay. So when we talk about when we're kind of doing some activity and we're kind of feeling like we're nudging into it a little bit, but it's not bad and we can still do it, that's what they're seeming to advocate for most folks tends to work the best. So yes, you can still work it, nudge it a little, and as long as you're not thrown back 2 to 3 days afterwards and you found what your limit is, then that's fine. The problem is I see with a lot of people is either they do way too little or they just go way above out of control and they're out for like a week. So it's trying to find that right line of what's the right amount for me that I can do and then being able to progress that. Nutrition. This is a big one. This is a very, very big one. Now, I'll admit I'm definitely not a dietitian, and I definitely would defer if you have specific things, go see a dietitian because they can help you out with better specific advice. But what I did want to share is kind of the big things that we do overall know from the dietary guidelines from the government and kind of from the respected nutrition organizations. Pretty much what they're finding is, and of course, you're eating a diet focusing on variety, has nutrient dense minerals and stuff, and within appropriate moderation. The key thing that we're kind of finding is, of course, limiting processed foods and sugar and eat more high fiber foods, aka plants. That is probably like if most people can do that one, I guarantee you they're going to feel a lot better. with stuff, being able to just limit the sugar and the processed stuff. And I know it's not that easy. Like, I understand depending on where you're living, there, especially where I live up in the city, I actually live up in Richmond. There are a few areas not too far from where I am where there are what we call, I don't know if you've heard this, but food deserts, where there's just not as many access to quality nutrition from the stores is just not there. I understand that completely, and I understand that it's in some ways it is more expensive in ways depending on where you go and such to be healthier with that. I know that. I know some places it is, but it depends on how you do it because it can totally be done that's still affordable, but it depends on how you do it. So yeah, that's what they're tending to find is adding foods that have a lot of variety, nutrient dense, with an appropriate moderation, while limiting processed foods, sugar, and eating more high fiber foods. Drinking more water and not soda. It feels weird for me to say soda because I'm from, it's always pop. But I think people will even be amazed, like when you actually cut out the soda, how much better you feel on the whole. Now, I will say this though, if someone is starting to make a dietary change, something from that, do not go cold turkey. Do not make a 180-degree switch because let's be honest, how well does that work out for us? Not very well for most folks. What we tend to find for most people is gradually weaning from bad foods and progressing new stuff in seems to be better. So let's say, for example, you have 6 pops a day or 6 sodas a day, excuse me. You have cans of soda a day. A good goal might be, you know what, in 1 to 2 days, I'm going to go down to 5 or 4 and then work that way. Or even if you're kind of like, you know what, I want to keep what I'm eating, but I want to make sure I'm getting something more healthy, then you don't have to take away that immediately if it's something you can do. Just add in the vegetables, add in the healthy thing, add it in. Like, you don't need to take away automatically. Like, I'd rather have someone do something healthy than nothing any day. Okay. And the withdrawal signs, like and especially when your body has been used to a certain cuisine for a while, once you start to wean from it, it doesn't feel nice. Your body doesn't like you. I had a really bad habit when I was a little kid about having ice cream at night. And I had that pretty much almost every other night. And I knew, I was like, I gotta stop that. And so I did the wrong thing and I went cold turkey. And let me tell you, that was a miserable 3 nights because your body is just so used to having that type of input and that nutrition that way that when you don't give it, it's like, what? I want it. So I had to purposely kind of say, no, you're not getting it. And then after a few days, never been a problem since. Again, I'm not advocating that for everyone. I'm advocating more the gradual wean route, but I'm just wanted you, the point of that is just so you know that when you start to make changes that way, your body can kind of give you some weird responses in return, some withdrawal signs from that. So just something to definitely be aware of when it comes to that. Sleep, a big one, a very big one. How many people in this room, raise of hands, are getting on average 7 hours, at least 7 hours a night? Not many, not many. And there's a lot of reasons for that, and I understand that completely. Sleep, as they're finding now, between exercise, sleep they're finding is probably either the second or third most prevalent issue for persistent pain. Now, we said exercise seems to have the strongest evidence. Sleep is creeping up there. There's a lot of evidence for sleep. Now, of course, we need to make sure that anything medical that can cause a sleep disturbance is ruled out. One of the big ones that I don't think most people are aware of or they don't think about is apnea. Because on a lot of the the sleep studies that they found for people that have insomnia, they're actually finding that when they actually screen these folks out in the study, they're actually finding that a lot of them actually have apnea that just weren't caught. So I think always making sure if someone is having a problem sleeping, make sure they've talked with their doctor to make sure there's nothing medical that's limiting that, especially apnea, because there's a lot of times where that's not picked up. And we can go through all the sleep strategies in the world, but if you have apnea, it's not going to change it. It's not going to change it. So how do we know if we're getting the right amount of sleep? Because it's not just time. For all you guys, I think there were 4 of you who raised your hands for at least 7 hours a night. You can have 7 hours, but if you're waking up frequently a lot, do you think that's still very good quality? No, no. So it's duration and quality. And what they're finding now is, how do you know if you're getting the right amount? You should feel very well rested and awake and alert upon awakening within the first 30 minutes that you're awake without caffeine. Without caffeine. That is what they have found, is that if your body can do that consistently, you are getting adequate quality and duration of sleep. Okay. Now, it's not that simple, and I get that. I know sleep is very, very complex, and I'm guilty of this myself. I need to improve my sleep quality as well on that avenue too. But there's a few key things that they found that we know can make a big difference for people. And again, it comes back to screening and knowing yourself. I will say one of the most common reasons when I'm talking with someone and they're having problems sleeping that's not apnea related, it's because they're stressing. It's because they're worrying about things. They're thinking about things. They're worried about what's going on at home. They're worried about what's going on in their family, finances, job, you name it. They're always focusing on that or thinking about that. And if we don't let the body and the brain relax and calm down, it won't. And what ends up happening with those folks is they end up worrying about it, worrying about it, worrying about it, and then they eventually pass out. That's usually what ends up happening for a lot of them. So I will say for that person who's always worrying or can't really turn off the mind, shall we say, when it comes to sleep, that's when relaxation, meditation, and mindfulness stuff can be really, really helpful and such. That's some really, really good stuff for that. Apart from that, some other big things, one of the other big things that's been really helpful for sleep is actually having a consistent sleep schedule. Going to bed and waking up at the same exact time of all the strategies that they've examined seems to have the most bang for our buck. I don't know about you, I'm all about efficiency. I want to do the best thing and see and focus on that for me. Keeping going to bed at the same time and waking up at the same time, one of the strongest variables. Now, yes, we do want to make sure we're going to bed early enough so that we get at least 7 hours. Don't go to bed unless you're sleepy. Establishing a bedtime routine, having the room be a little bit cooler, making sure the lights are dimmed in a way. Some people, if they can't, depending on the lighting, they'll take kind of some of those little, I'm totally blanking on the name, but you know what I'm talking about, those things. Yeah, the mask, the things that you wear over the eyes to block out light. I use those, and they're very, very, very nice. Caffeine intake. This is a big one. I know most people don't usually drink caffeine before bed, but I don't think people realize. So the half-life of caffeine is 6 hours. So what that basically means is if I have, let's say, what time is it now? It's almost noon. So say at noon, if I have a coffee or a pop, whatever you may say, at 12 o'clock, and I have that full amount of caffeine in my system, at 6 o'clock, I'm still going to have half of what I had at noon. So it takes a while for that caffeine to really get out of our system. And depending on how your body is, because some people can have a great tolerance to caffeine. It's like for me, I can have a coffee a couple hours before bed and I can still pass out. But that's not everyone. There's some people that, oh, they're going to be up all night if they do that. But there are some that can sleep right through it. So I think as long as you're aware of that, I think that's just something really, really interesting to be aware of. Not really doing a whole lot of strenuous activity or exercise immediately before you go to bed. They actually recommend the best time in terms of for exercises either in the morning or in the afternoon. They usually don't recommend it so much in terms of at night because of for sleep. Because when you're working out at certain intensities, your heart rate gets elevated, and then it's going to stay elevated for a certain amount of time until it comes back down to its normal baseline. So they have found that doing that having the exercise or working out more in the morning or afternoon seems to be a little bit better for folks. Again, it's not absolute. Psychosocial, so mindset and such. So I don't know if you guys can read this. This is, you all know Jim Carrey, right? Ace Ventura, and he's done a lot of other stuff. I always thought this quote was so important, and I thought it was so spot on. It says here, quote, "I believe depression is legitimate, but I also believe that if you don't exercise, eat nutritious food, get sunlight, get enough sleep, consume positive material, and surround yourself with support, then you aren't giving yourself a fighting chance." And that's kind of speaking into the whole multifactorial nature that depression is. I am not a psychologist. That's not something I treat. That's not something I dive into. But I recognize its importance, and I recognize it can certainly have an effect for a lot of folks because pain can affect our mood. Our mood on a lot of things can affect a lot of things of what we do in life. What we think can have a huge effect on us. We were talking about that earlier, is that having a positive mindset and being an active participant in your recovery have strongly been shown to be much better predictors of having a much better outcome over longer term, rather than someone who's the other way around. Now, I know what you're probably thinking. That's a whole lot of stuff. What do I do? Right? What do I do? My goal for you is if you're having a specific issue that you're not sure about, one, make sure you've seen the right medical professional to figure out and make sure there's nothing medical. Two, follow up with the other professional that they refer you to depending on what they recommend. If you're making a lifestyle change, like say if you're looking to work on exercise, nutrition, sleep, my advice is to actually start with one at a time. When people try to address health and on a full scale, like I'm going to work on my sleep, my diet, and my exercise, that can get very overwhelming, and usually it's not successful, and then people regress right back to what they were doing. I've usually seen more people have success when they focus on just one at a time. Like, you know what? I know I need to work on my exercise. I know I need to work on my diet. I know I need to work on sleep. Because I actually want to make it sustainable for me, I'm going to choose one and just focus on that. So I'm just going to focus on just nutrition. All right, what am I going to do in nutrition? And they focus on that. And then when nutrition isn't that much of a deal anymore and it's not that much effort for them, or if they're not really thinking or putting as much effort into it, then they switch. Like, okay, I've got the nutrition part down. Now I'm going to go more into exercise. And now I'm going to start that avenue rather than doing them all at once. Because doing them all at once, more often than not, most people end up not fulfilling it all the way through. I also recommend you have an accountability partner, whether that be a spouse, a friend, as such, or even someone that you meet at the gym or whatever the case may be. Having someone to push you and keep you accountable can be really important because we all have days, and I'll admit I'm guilty of this too. We all have days when we want to do something, or we know we need to do something, and we're like, you know what, there's tomorrow, or I just don't feel like it. And we do that. We do that as humans. But sometimes it's really good to have that accountability partner that can keep us honest and keep us accountable because then we won't then we won't risk going into that. And probably the final thing that's probably the most important is to start. Do something with it. Think about what you need to do. Think about what's going on for you or your family member, whoever you're here for this for. Think about the situation and figure out how is best for you to move forward.